I am Shaun Holt, MD. I'm an orthopedic surgeon. I specialize in shoulder and elbow surgery. When did I first realize I wanted to go into medicine? Well, that probably goes all the way back to junior high school and our first dissection, the fetal pig dissection, and I was just absolutely fascinated by the anatomy and how everything works together. And at that point, I made it my decision that in some way or another, I wanted to be involved in medicine. The idea of surgery actually came later on as I was studying medicine, when I wanted to actually be the definitive endpoint for patients' care, and that's what naturally gravitated me towards surgery. The special procedures that I do and the training that I've received have really emphasized around arthroscopic and minimally invasive treatment of musculoskeletal injuries, particularly of the shoulder and the elbow. The shoulder is one of the most complicated body parts to get well. It was always the biggest challenge, especially 25 years ago. And I love a challenge. I love that sort of aspect of medicine, and that's really what started driving me in that arena. As we got into that arena, it's also even more challenging to be able to do these things in a minimally invasive or non-invasive way. And that has been the focus of my career. That has been my passion, developing those techniques, learning from the best in the world, and taking that experience and making it my own. Our approach to patient care ranges from conservative measures to ultimate surgery. And when and where appropriate, we always would choose conservative measures, and we'll give every attempt to get a patient well non-surgically. When the time comes, because there are some issues that are just not treatable without surgery, then we specialize in arthroscopic and minimally invasive surgery for those kind of opportunities. Messages that I would give my average patient. That is, for one, do not ignore symptoms. Most normal things, most normal aches and pains, bumps, bruises, and sprains will generally start to resolve within a few weeks, maybe a little over a month at the long end. If symptoms are persistent or they're getting worse, especially beyond that time frame, it may not be anything serious, but it's at least worth having investigated. And in those ways, we do avoid scenarios where something may become unfixable or it's too late to address the problem. So timely recognition, acknowledgement of the symptoms, and if they don't go away in a timely fashion, which would be less than a month, seek treatment for that. I've been very fortunate because of my location here in Houston, our close proximity to Johnson Space Center, that I've become actively involved with treating astronauts along the way there. And that ranges from therapeutic intervention, injections and surgery, physical therapy, injections in clinic, to physical therapy and eventual surgery if they need to do that. It's been a very, very great blessing. My close proximity has also allowed me to be part of the new spacesuit design program, so it's been a blessing to be in this location, and we love that aspect of it. The community outreach that I do, me personally as well as my group, we engage in community support for athletic programs. We cover high school teams as a volunteer because in the state of Texas, physicians are supposed to be on the sideline. So that is something that we are passionate about. We volunteer those services, and we're actively engaged in the community, as well as many charity events that might be happening along the year there. And there's virtually not a quarter that goes by that we're not involved in a charity of some kind. My team at HBH is amazing. I have some of the best nurses and techs available. They show up to the job, and it's a stressful job. Medicine is hard, it's demanding, but they still show up with a smile on their face, and we get the job done. And that is a great environment to be in. I choose to work at Houston Physicians Hospital because it's a physician-owned hospital. It puts physicians' needs first as well as patients' needs as well. And it's a very, very good combination when you have a hospital that values both the surgeon's opinions as well as the patient's experience and their outcomes. It's a very, very unique experience, and I choose to be a part of that winning team.